It's about the size of a coffee cup, and it's seen as another tool in the country's toolbox to fight the pandemic. The federal government has now approved a made-in-Canada rapid COVID-19 test, but there have been concerns with this one in the past. The test, developed by Ottawa-based tech company Spartan Bioscience, is being touted as the first truly mobile rapid PCR test for COVID-19 for the Canadian market. With no special requirements to ship the kits, the company is hoping they can fulfill an urgent need for reliable testing in places with limited lab access.
And it allows us to use it in multiple settings like workplaces, remote oil and gas sites, schools, remote communities, mobile testing stations, etc. So basically, any place that you have access to power, our system can be set up.
The way it works is you would swab your nasal area, put the swab into this cartridge, which goes back into the cube, and within the hour, you'll have your results. But the device was voluntarily recalled in the spring.
What really came to light back in April was that the swab technology that was being used at the time was not consistently gathering enough cells to get a consistent, accurate reading.
Spartan has now replaced the swab it was using, and Health Canada says the new version meets its requirements for safety and effectiveness. The company says it's ready to supply tens of thousands of kits.
We're ready to start shipping as early as next week. We have standing orders now with the federal and provincial governments. We have been gearing up our production, and we'll be producing about 200,000 kits a week. And those are all earmarked for the Canadian market.
Spartan says it's working with Ottawa to determine who will receive its products first. Now, the approval of their device comes as the Chief Public Health Officer warns Canadians to keep up COVID-19 public health measures. She says to ensure that we can reach the end of this marathon. Now, while Canada's biggest COVID-19 hotspots, Ontario and Quebec, both saw decreases in cases this weekend, Dr. Tam says she remains deeply concerned about new variants of the coronavirus believed to be more contagious that continue to pick up pace. For City News, I'm Caryn Ceolin.